What's up, everyone? Welcome back to the Daily Sean. For those of you who have never been here before, my name is Sean. I do a daily video called The Daily Sean. Took a lot of time coming up with that name, didn't I? A daily video on something related to nursing. No, there is no rhyme or reason. Probably won't change. I interrupt you from your normally scheduled Daily Sean. Oh my god, for those of you who haven't been following me on social media, yesterday was a monumental day for me. Had knee surgery 6 weeks ago. Torn lateral meniscus, complex repair. I've been on crutches for 6 weeks. Wasn't able to put my foot down on the ground for 6 weeks. And yesterday was the first day that I could stand on my own 2 feet in almost 2 months. Enough of that. Today's topic is another fan question, fan request, something that a fan brought to my attention. It was a nurse I follow on Instagram and other social media platforms, That Nurse Bert. Should definitely go follow him. He has a lot of good info out there. I'll drop the link down on the bottom here. He posed a very important question that is not a new question in any way. He posed the question on Instagram that got a lot of attention. Should family be present during a code? Yay or nay? Should family be present when a family member is in the process of trying to die? This is a very challenging answer. There is no blanket answer. You can't say yes for everything, no for everything. You can't blanket answer that question. Current research has suggested and has proven that family presence during an emergency, condition A, code blue, whatever you want to call it something different everywhere. Probably going to come up with a new acronym soon. That when the family is present, they have a good experience regardless of the outcome, which is sort of important. 80% of the time, it's not usually a good outcome. It's not Hollywood medicine. It's not like in the movies. Shaking it, oh my god, it's a miracle! No. In reality, survival rate is dependent upon the actual code itself. Should family be present? In my professional opinion, the family should get the choice. With the caveat being, they understand the ramifications of their decision. They need to be prepped. They need to be informed, to be transparent. What they are about to see is traumatic in some way, shape, or form. Every code is different. Sure, we all follow ACLS protocols. ATLS resuscitation. From a family member, loved one perspective, we are going to be poking, prodding, pushing, pulling, causing traumatic damage to that human being's body in some way, shape, or form. They are going to be cut, sliced, poked, prodded, punctured. Orifices are going to be opened. Blood, feces, bodily fluids everywhere. Noises, you name it, it is ugly in every way. It is not Hollywood medicine. Sit straight up in bed and start talking to you. Family's perception is their reality. And currently, the popular opinion is Hollywood medicine. The popular perception out there is what happens on television or in the movie. Trust me, it's a constant battle to try and fix that. Whoever is deciding to be at the bedside, they need to understand that piece of the puzzle. They have to understand it is not going to be pretty. We are going to do things to their family members that is traumatic. And they need to understand there is no guarantee. We could do everything in our power. We could exhaust all of our resources. We could bring every member of the hospital into their room, and there are just some things that we have no control over. Medicine only takes us so far. If they are okay with that and they want to be at the bedside in the room within view, then by all means, I think they should. They also need to understand they cannot interrupt, interfere, get in the way of anything that we do. Emotions are going to run rampant. You're going to have those family members. They need to understand they have to do that away from the area we are working. They cannot interrupt anything that we are doing. Otherwise, it will affect how we perform our job. Absolutely, they need to express themselves in whichever way they need to express themselves. But they cannot get in the way. Getting in the way of communication. We are going to ask you to step away. Part of the resuscitation effort is clear, concise, audible communication between team members. We're going to have to ask you to step out. You can express yourself in any way you want, any way you feel appropriate. If that expression gets in the way of us doing our jobs, we're going to have to ask you to step away. From a staffing perspective, you need to have the support to accommodate the family. Do you have the proper amount of staff? If you are working on a skeleton crew and it's just the team leader and 2 people to help resuscitate, more than likely you should not have the family member at the bedside. You only have 6 hands to perform all the efforts you need to perform. If you have minimal amount of resources, the room that it's being done in is small, you have to take all these things into consideration. If you have optimal environment capabilities, then yes, be transparent and let the family member stay. Let them be present. But if you are running on a skeleton crew and you don't have the resources, you don't have somebody that can tend to the family member while you are performing your efforts, then you should not have the family member there, because you need to anticipate the worst case scenario. That's going to need to be handled. You're going to need a team leader, the respiratory therapist, or someone who's managing the airway. You need 1 to 2 people performing the chest compression, 1 to 2 people actually doing blood draws or performing some sort of bedside procedures, up to 10 members performing a duty at a given time. You got to have a recorder that's recording everything. You got to have someone manning the actual machinery. These are things that need to be taken care of before the incident happens. How am I supposed to do that beforehand? That's impossible, Sean. That's what's called proper planning. 7 P's. Piss poor planning prevents piss poor performance. You know what I mean. That has to be a part of your facility's plan, unit's plan, department's plan. Those who are in charge need to be aware of these things. In-house supervisors, hospitalists, the intensivist, anesthesia, or the code crew, rapid response team. You need to have the family member's presence a part of your plan. When the family shows up, you're ready for them. And it should be a part of your plan anyway. The worst case scenario is starting to play out. Someone has to make a phone call and talk to the family. The first question that should come up is, are they a full code? It's kind of important. Yeah. Yes. Are they a full code? What are the parameters we're discussing here? Yes, I am not agreeing with partial codes, chemical code. We all know what I'm talking about. You have to follow the patient's wishes. Follow the patient and the family's wishes that they have already agreed to before this happened. If you don't have that information at the time of the emergency, then you proceed as if they wanted everything done. This is a great topic of discussion. I can't wait to hear what you have to say about this. My opinion has changed greatly over the past 6 months, past 3 months, being the actual patient versus the provider. I have very different views on how my care should or should not be performed and the care that I provide. Everybody who delivers healthcare should be a patient. You'll be surprised at what you learn. Always love to hear your feedback. You gotta leave me a comment. You gotta share this one. Share with all your friends, your family, all of your healthcare colleagues. Thumbs up is always appreciated. Share it with somebody. And as always, check your own pulse first.